This medication, Norgestimate-Ethinyl Estradiol, is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, this birth control pill can also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect against sexually transmitted diseases. As for the daily dosage and timing, it's best to take this medication at the same time every day to ensure its effectiveness. Before you start taking Norgestimate-Ethinyl Estradiol, make sure to read the patient information leaflet provided by your pharmacist. This leaflet will have important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Make sure to follow the manufacturer's directions for your specific brand. It's crucial to continue taking this medication exactly as prescribed by your doctor. Make sure not to skip any doses, as this can increase the risk of pregnancy. If you experience vomiting or diarrhea, use a backup birth control method and consult with your doctor or pharmacist for more details. You may choose to take this medication after your evening meal or at bedtime to help with stomach upset or nausea. But no matter what dosing schedule you use, make sure to take this medication at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, follow the specific instructions for the first cycle of use provided by your doctor or pharmacist. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Norgestimate-Ethinyl Estradiol include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, contact your doctor or pharmacist. This medication can increase your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes high. Contact your doctor immediately if you experience any serious side effects such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. Norgestimate-Ethinyl Estradiol may rarely cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, unusual sweating, weakness on one side of the body, or vision problems/changes. In the case of a serious allergic reaction, seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you're over 35 and smoke cigarettes or use tobacco, you should not use Norgestimate-Ethinyl Estradiol. This is because smoking can increase your risk of experiencing serious problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like the pill, patch, or ring. It's important not to smoke or use tobacco while taking this medication to reduce these risks. It's also important to discuss any concerns with your healthcare provider. Before taking Norgestimate-Ethinyl Estradiol, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, or thyroid problems. If you have diabetes, it's important to monitor your blood sugar regularly and share the results with your doctor. This medication may affect your blood sugar levels. If you have diabetes or phenylketonuria, caution is advised with chewable tablets that may contain sugar and/or aspartame. It's important to inform your doctor if you will be undergoing surgery or if you will be confined to a bed or chair for a long time, as these conditions may increase your risk of getting blood clots. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Norgestimate-Ethinyl Estradiol may cause blotchy, dark areas on your face and skin, and sunlight may worsen this effect. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses while taking this medication. It's important to contact your eye doctor if these problems occur. It's important to note that it may take longer for you to become pregnant after you stop taking birth control pills, so it's important to consult your doctor if you have any concerns. Norgestimate-Ethinyl Estradiol should not be used during pregnancy, and if you become pregnant or think you may be pregnant, it's important to tell your doctor right away. If you have just given birth or had a pregnancy loss/abortion after the first 3 months, it's important to talk with your doctor about reliable forms of birth control and when it is safe to start using birth control that contains a form of estrogen, such as this medication. This medication may also decrease breast milk production and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how Norgestimate-Ethinyl Estradiol works in your body. Some products that may interact with this drug include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, leading to a decreased amount of birth control hormones in your body and potentially resulting in pregnancy. It's important to inform your doctor if you start any new drug and discuss if you should use additional reliable birth control. It's also important to notify your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Furthermore, be aware that this medication may interfere with certain lab tests, potentially causing false test results. It's crucial to make sure that lab personnel and all your doctors are aware that you are using this drug. If you or someone else has taken too much Norgestimate-Ethinyl Estradiol and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share this medication with others. Make sure to attend regular physical exams, including lab tests, while taking this medication. These exams may include checking your blood pressure, breast exam, pelvic exam, and pap smear. It's essential to follow your doctor's instructions for examining your breasts and report any lumps right away. Remember to keep all your medical and lab appointments. If you need more information, consult your doctor for further details. If you miss a dose, refer to the product package for instructions. You might need to use additional birth control methods, like condoms or spermicide, to avoid getting pregnant. If you have any questions, talk to your doctor or pharmacist. If you have trouble remembering to take your pills, speak to your doctor about trying a different form of birth control. It's important to store Norgestimate-Ethinyl Estradiol at room temperature, away from light and moisture. It should not be stored in the bathroom and should be kept away from children and pets. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.